If you think that being overweight only affects your appearance and overall health, think again. Did you know that obesity can also lead to breathing difficulties? I bet you don't. In this video, we will discover the correlation between respiratory issues and obesity and how it affects individuals' daily lives. People often wonder why people who are overweight commonly experience breathing difficulties, which range anywhere from merely puffing for air to a potentially fatal condition named Obesity Hypoventilation Syndrome, OHS. Obesity is a loaded term. It brings to mind individuals who struggle with their weight and often face a series of health issues as a result. One of these health concerns is respiratory problems. Imagine trying to climb a set of stairs and finding yourself gasping for breath halfway up. Not a pleasant experience, certainly. Now, these respiratory issues are not simple things like you might expect. They range from being mildly out of breath to potentially life-threatening conditions. This severe condition that we're talking about is called Obesity Hypoventilation Syndrome, or OHS for short. The science behind obesity and respiratory difficulties. Obesity has the potential to cause problems with your breathing in two distinct ways, directly by limiting lung function and indirectly through various physiological mechanisms. When we gain weight, it tends to follow one of two set patterns. It's either central obesity or peripheral obesity. Central obesity refers to when the weight piles up around the chest and midsection, giving one an apple shape. On the other hand, peripheral obesity is when fat gathers mostly around the hips, thighs, and limbs, leading to a pear shape. Have you ever wondered why shortness of breath is often linked with obesity? That's primarily because of central fat gain. When fat accumulates around your chest and abdomen, it poses restrictions on your lungs' expansion capacity, even in a resting state. This situation can modify your normal breathing pattern and result in a constant shallow breathing pattern. Indeed, obesity doesn't stop there. It can also lead to the narrowing of the airways and, in worst-case scenarios, the complete closing of the airways. But central obesity doesn't just physically restrict your breathing. It also significantly affects the body's physiological mechanisms that are connected to breath-related problems. It is responsible for a persistent low-grade inflammation that can further trigger metabolic syndrome, overproduction of hormones, and disruptions in sleep due to erratic breathing. Fat distribution and breathing issues. Where the excess weight goes matters. When fat stacks up around your belly, it can go hand in hand with declining lung function and worsening respiratory symptoms. Interestingly, the fat stored in the lower parts of your body doesn't seem to have the same effect on your breathing. Every ounce counts. Piling up fat tissue in and around the stomach area is believed to interfere with how your diaphragm works. This simply means that the more fat around your abdomen, the tougher it is for your diaphragm to move freely. It leads to a restricted rise and fall of the lungs during breathing in, hence a limited lung capacity. Just when you thought it couldn't get any worse, here's a reality check. Unfortunately, the performance of your respiratory muscles, the ones helping you breathe, can go downhill in overweight individuals, much like in respiratory illnesses such as chronic obstructive lung disease, COPD. Hence, the connection between excess weight and breathing problems is indeed a glaring sign to watch out for in promoting overall health. Obesity-induced respiratory disorders. Research shows that weight-related issues can have a profound impact on our breathing, leading to conditions such as asthma. If you happen to carry extra weight, there's a higher chance you could experience amplified symptoms of asthma. It's shocking but true that the likelihood of developing asthma spikes by 38% for overweight individuals and skyrockets to a staggering 92% for those classified as obese. Not only do obese persons have a greater chance of contracting asthma, but they also face more severe outcomes. Their frequency of intense asthma attacks is greater. They find themselves reaching for their inhaler more often, and their emergency room visits rack up. Hospital admissions? Unfortunately, you guessed it, those are elevated, too, when compared to their leaner peers with the same condition. Obesity isn't just a silent danger for asthma. It also plays a starring role in a condition known as Obesity Hypoventilation Syndrome. People struggling with obesity often have a smaller lung reserve, making it challenging for them to supply their bodies with the oxygen they need. It can lead to a condition called hypoxia, when your body or a specific region of it is deprived of adequate oxygen supply. Imagine that you've just walked up a flight of stairs, and suddenly, you're gasping for breath, almost like you've been running a marathon when all you've done is climb a few steps. This can be a sign of dyspnea, also known as breathlessness, and you might be surprised to learn carrying around those extra pounds could be the culprit. A recent study conducted across the breadth of Australia revealed that obesity's role in dyspnea is far from insignificant. According to this eye-opening national survey, 25% of all breathlessness symptoms reported were linked to excess weight, a statistic that's as startling as it is concerning. However, don't be too quick to chalk up this winded feeling to a lack of exercise or poor fitness levels. There's more to the story when it comes to the link between obesity and shortness of breath. Delving deeper, we uncover that obesity is not just about having extra weight. It's a condition that can cause inflammation and alter the way our lungs work. Ever wondered if shedding those extra pounds could help improve your breathing? Turns out, the answer is a resounding yes, particularly when it comes to breathlessness related to obesity. When we're carrying around extra weight, the best way to alleviate symptoms like shortness of breath is by dropping those extra pounds. Research has consistently shown that weight loss goes hand in hand with an improvement in OHS, Obesity Hypoventilation Syndrome, symptoms. When you kick that extra weight to the curb, you will likely notice a decrease in carbon dioxide levels and an enhanced lung function. Yes, it's important to note that weight loss isn't a one-size-fits-all solution. Still, a significant weight loss of 25% to 30% of your total body weight can make a noticeable difference when combating OHS. Following a rigorous diet and exercise regimen to achieve this level of weight loss isn't everyone's cup of tea, and it's not always feasible for many. Because of this, bariatric surgery is often presented as an alternative. This procedure modifies the stomach or intestines, leading to a decreased food intake, less hunger, and a heightened sense of satisfaction after meals. If you would prefer to tackle your weight loss journey through diet, remember that slow and steady wins the race. Wellness professionals like your doctor and dietitian can be pivotal in devising a safe and effective weight loss plan. Losing weight too rapidly can have a boomerang effect on your health, even when your ultimate goal is managing a condition like OHS. If you like this video, make sure to give it a thumbs up, subscribe to the channel, and share it with your family and friends. Stay tuned for more informative videos on health and wellness. See you next time.